What's up, everybody? This JT Corsos and Bullies coming at y'all with another update. I had a dog that was diagnosed with parvo. I saw the changes in her. She was not eating food, and in this video, I'm gonna go over with y'all some of the things that I purchased and gave to her in order to keep her alive and survive parvo. As most of you know, parvo infected in a dog is basically like a death sentence. So it's best to have a proper protocol in order to get your dog over the parvo sickness. Parvo is basically like the dog will stop eating. They will stop eating, stop drinking. They will have an infection of their stomach. Their stomach lining will be shedding, and they will be very uncomfortable to eat or drink, and it actually will make them nauseous. They not only will have those issues, but they also will have diarrhea. So with not drinking water and having diarrhea and possibly vomiting, this can lead to dehydration. So one of the biggest things that we want to do is we want to hydrate our puppies or our dogs. So the first thing that we want to do is make sure that we're hydrating them. So one thing that we can do is we can get Pedialyte or a pediatric electrolyte solution. It's best to get unflavored. If we get flavored, that could be problematic. It might have some artificial sweeteners or sugars or things of that nature. But again, we can get Pedialyte or a pediatric solution to help hydrate the puppy. What you want to do is you want to get a syringe. You want to get a syringe and fill up the syringe with it could be 20 milliliters, it could be 10 milliliters, depending on how often that you are giving this solution to the puppy. And you want to give that syringe and the Pedialyte by mouth to the puppy. Now it'll be little by little because they probably will be reluctant to take anything because it makes them nauseous. All right, but this is the first thing that we want to do. All right. I want to bag up. The first thing that we want to do is we want to go to the vet. And the vet will tell you that the puppy is sick with parvo. Or the vet will tell you that the puppy is sick with coccidia, because parvo and coccidia are similar as far as the effects of what it has on a dog. So from there, if they tell you that your dog is sick with parvo, we want to make sure that we're asking for the right things. And first, the vet will tell you, hey, we can take the puppy in, the dog in, and we can hospitalize it, and that'll be about $600. Or we could give them this shot that will give them some type of antibodies to fight off the parvo. If you have the money for that, cool, go ahead and do that. But if you do not, then these are the things that you should do. So at the vet, they should give you antibiotics. The antibiotics can be amoxicillin, it could be clavamox, it could be flagyl, it can be some type of antibiotics, broad range, that will help kill or push out the parvovirus. The next thing that we want to do is we want to have the puppy hydrated. I already showed you about the Pedialyte or the pediatric electrolyte solution to get fluids into the puppy. But another thing that we want to do is we want to ask the vet for an LRS bag. That is, if you could read that, is backwards, a lactated ringers injection USP. We want to get a lactated ringers injection USP. All right. So when we get this has the electrolytes just like the Pedialyte, but this will go under the skin of the puppy. They call that like subcutaneous fluid under the skin that the puppy or the dog will absorb. All right. In my case, I had a 20-pound puppy. I was told to give them 100 cc's of this per day. We have this one here, so everything above that probably would be 100 cc's, but they tell you to insert this part into the bag, and then from there, this area will fill up. Then there is a roller. You roll this up. When you roll that up, the fluid will start to flow, it will flow into this dripper. It will flow down the tube, and then from there, it will flow out of this end. This end is where we put the needle, and which we will be giving to the puppy. When we put this needle into the puppy under the skin, we will pinch the skin of the puppy. Let me back up. First, we want to make sure that we have no fluid in this, no air in this. So we roll this down. The air flows through here. You see little, can you see the air bubbles? You can see the air bubbles here. The fluid will flow and it'll push out these air bubbles. We don't want any air bubbles to go into the puppy. So we allow it to flow and flow and flow until we have all of the air bubbles have gone through this. When it has gone through, then we will again roll this. We rolled it up to get the flow. Then we roll it back down to stop the flow. From there, we will take this syringe, take this needle, we take the top off, and we will pinch the skin of the puppy. We put the needle under the skin of the puppy, like we want to make a tent. So we grab the skin of the puppy, we hold it up, we make a tent, and we push the needle in. We don't want the needle to puncture out the other side of the puppy's skin. So we take the puppy skin, we puncture the skin, and from there, we want to make sure this does not move. We will, this works by gravity. So this bag needs to be higher than the puppy, much higher than the puppy. When the bag is higher than the puppy and we have the syringe inside the puppy, we will roll this part to allow for the flow of the liquid. As the liquid is flowing, we will watch the puppy and watch the liquid. When the liquid, let's say if it started at 1, we will watch the liquid go down to 2. That would be the 100 cc's for this 20-pound puppy. From there, we have enough fluid into the puppy for the day. We pull the needle out of the puppy and we kind of hold our finger there. We need to have gloves on. We put the finger there to stop the flow of the fluid coming back out of the puppy. Then from there, when we're sure that the fluid will not come back out of the puppy, it's good. Now, during the process, you'll notice that the skin of the puppy is filling. It is filling with this liquid here. Now, that's exactly what it's going to do. Then, as time progresses, the knot from this liquid will go down in the puppy. And then from there, the puppy will be absorbing this into them and they'll be getting hydrated. Right? So we want to go to the vet, get the antibiotics. The antibiotics, I told you those types. We want to give those as prescribed by the doctor. We want to ask for an LRS bag. And we also want to have Pedialyte. So we give the LRS bag under the skin, subcutaneous. And we get this Pedialyte. We give this by mouth. That's to double, make sure that we're hydrating the puppy. Another thing that we can do is we can add this anti-diarrhea liquid. This will prevent the puppy from, or dog, I'll say puppy. I'm just going to say puppy. I'm not going to say dog. This will prevent the puppy from having diarrhea. It may not be 100%, but it should help to prevent diarrhea. And from there, the puppy can have more of the fluids inside of it. They have other medicines. This is NutriVet. So they have other medicines for anti-diarrhea, but this is what I chose. And another thing that we give is also when the puppy is time for them to eat again, we want to make sure that we're giving them good gut bacteria. So the vet had provided this for me, Forte Flora, but it was the pro version. That helps with the gut bacteria. That helps the puppy have a good gut bacteria to digest the food in which it is eating. I'm giving this to all of my dogs to make sure that all of them have a good gut bacteria. And I think that is about it. But another thing that I also used was Rebound. I used actually this Rebound before I gave the dog or the puppy the food. So this Rebound, it has some vital nutrients, healthy digestion, and healthy appetite. It's a unique blend of essential nutrients to support a healthy appetite in dogs. So this was the first thing that I gave by mouth, and I still have more of this left. It comes with, of course, like protein, fat. Um, it has some amino acids in it, zinc, D3, thiamine, just different nutrients in here to help the puppy start eating. Now, the first food that I tried to give was this Wilderness, Blue Buffalo Wilderness. I guess because the puppy had not eaten for a long time, I was trying to give her something that was higher in protein. Of course, dry dog food and wet dog food has different nutrient profiles, but this says crude protein 8%, crude fat 2.5%. I'm sure that's much lower than what it says on the dry dog food, but nevertheless, this is what I gave. And following 1 or 2 days of just giving this, I started back giving actual dry dog food. So I gave the good gut bacteria and I gave the dog food to help the dog recover from parvo. From there, I tried to make sure the whole time that I keep the area clean. So daily, twice daily, I would take the puppy out. I would take the bottom of her crate out. I would spray that down with bleach. I would spray it off with water. I changed the puppy pad, the pee pad, the poop pad. I changed that out and just try to keep the whole area clean. So inside the kennel, I had a pee pad, but on the floor I put 2 more pee pads, so that way if she had any diarrhea type thing, I would not have any issues with that. So that was the protocol that I used. So again, I'm gonna run down with you again. When you identify that your dog is not eating, it's an issue with that. They're not eating, they're not drinking, they're vomiting, things of that nature. They're not acting normal. Take them to the vet. When you go to the vet, if they tell you the dog has parvo, if you do not have the money for the vet to keep the dog, what you need to do is make sure that you understand what you need to do to keep that puppy alive. So I'll take the puppy home and I'll ask for all of these things. All right, so 1, you need to go to Walmart or wherever you go and get you a pediatric electrolyte solution. It could be Pedialyte. All right, this is what you'll give in a syringe by mouth to hydrate the puppy. What you want to ask from the vet is for an LRS bag. With the LRS bag, you put this part, it punctures into the bag under this part here. All right, it punctures into the bag, it drips. You use this to roll to get the fluid flowing. Where is that? This right here is what you use to put it into the puppy's skin. You pinch it up, put it in the skin, let it flow. Backtrack. We want to make sure that we have no air in this line. When you have no air in this line, now you're ready to puncture the skin. You make a tent, puncture the skin, you let it flow. For me, I had a 20-pound puppy. I gave 100 cc's, so from the 1 to the 2. When I gave her 100 cc's, I closed this off. I rolled this back up. I put the top back on to keep this sanitary. I got different needles, so each time I changed this needle out, I took this needle off. It's a little bit difficult sometimes, but you saw that roll, and then from there, you make sure you don't puncture yourself with this. My goodness. Sometimes you could do it easier off camera than you can on camera. But either way, however it go. I'm not gonna waste too much time on this. So I changed this needle out each time. Then from there, I got my fluids in the puppy. Now what I want to do is I want to make sure that I have the antibiotics. So that could be amoxicillin. Clavamox is something else mixed with amoxicillin. So amoxicillin is one thing, but clavamox is two things together. Flagyl is something else to help knock out the parvo. So then outside of the vet, I use this for anti-diarrheal. The first thing that I gave as far as nutrients was this Rebound. I was trying to give some baby food chicken. The first step, baby food chicken. That did not work too well. The dog just vomited that. So I gave this Rebound. The first food that I gave outside of that Rebound was Blue Buffalo Wilderness. I know it says trail toppers, but I gave this just like a normal food. That's probably why the protein was so low. And from there, I had the 40 Flora Pro, which I sprinkled on top of the dog food. It comes in sachets. You can just sprinkle it over the dog food. And from there, my dog was able to survive parvo. All right. So if you have any questions, you could drop it in the comments below. And my dog, she was able to survive. So hopefully, if you're having an issue with parvo in your yard, this video will help you out and your puppy will live. All right. JT Corsos and Bullies, thank y'all for tuning in.